Hey everybody, it's Sherry Joe. Welcome to the first episode of Excellence at Emerald. And today on our first episode, we're going to talk about 5 things. We're going to talk about our tablets, we're going to talk about PayCor, we're going to talk about HHC, we're going to talk about schedules, and we're going to talk about insurance. So let's get right into it. So we've been talking about getting the tablets into the homes, and we're just waiting on a couple of keyboards, but those are going to be implemented over the next week to week and a half. It's absolutely critical that everybody get trained right away so that there is a much smoother process in making sure that the documentation is done and that your timesheets are in correctly. We will give you plenty of information on how to operate this with a backup user guide. You'll have access to our website, to the app, to PayCor for clocking in and out, and of course, your documentation. So let's then move on to PayCor. So PayCor is going to be the new system that we're changing to for your payroll. Now you log into ADP and get your information, your pay stubs, things like that. You're going to be given a username and password through PayCor, and in order to do that, we have to have an accurate email for you. So if we don't have an accurate email on file, please contact either Julie or Will and get them your information right away. We're going to be going live for PayCor on April the 26th, which means that is going to be for the pay period of April the 7th through April the 20th. And so right now, the way it stands is you're going to get a paycheck this Friday, and then next Friday you're going to skip, and then the Friday after that you're going to get 2 weeks worth of pay. And that will be on PayCor. Now, you may not have your tablet in the home for those first few days of all of this stuff getting the PayCor ready. However, we do have a plan for getting all that information in correctly the same way that we're entering it in now. Okay, so that brings me to HHC. HHC is our documentation system. So when you enter the home, you're going to clock in through PayCor, and then you're going to sign in to HHC. And that's where you will enter your visit note. Again, there's going to be lots of documentation and lots of training. It's going to make your documentation process so much more efficient. You're not going to have to call in anymore and verify that you have your timesheets here. You're not going to have to worry about whether or not it's accurate. If you've put it in and it's according to the schedule that you've agreed to work, or that you're supposed to be working, then we will most definitely simply process it as is. Which brings me then to the next piece of schedules. It is going to be absolutely imperative that all of us have schedules in effectively. So those of you that self-schedule with your families, we're going to be implementing a new process for you to be able to upload what it is that you are going to be doing. And if that changes, you have to let us know, because you actually won't be able to document your time if you get to the home and the visit's not in. And then therefore it'll be a challenge to get paid, and nobody wants that. Okay, so the last thing is insurance, and I will do a recap because I know this was very, very quick. But insurance, so this doesn't apply to all of you, but most of you, or some of you at least that are full-time, chose to go ahead and come with us for insurance, health insurance. And we had a great plan in place, and lots of people took it, and then they said, oh, wait a minute, you have too many people. Let us get you into a group plan. So I want to give you an update on that and where we stand with it. Number one, as the person that is responsible for helping you get the best things possible as a team member, I am not the slightest bit pleased with the rates that they quoted us. So we're gonna have to delay for just a little bit more. Any funds that you have already had withheld for your insurance from this pay or last pay, we're gonna go ahead and give that back to you because I'm not sure what the plan is gonna look like right at this minute. It started off really good, but then when they put us into the group plan, it was a lot more expensive, and I just didn't think it was the best thing to offer you, so we're going to put it on hold. Okay, so any questions about that, you call me, call Will. We're all willing to help, and everybody here will know about it at the same time that you know about all of this. So let's see. All right, let's recap. Tablets, they're going to be coming into the home. If you can come to the office for training, that would be supreme, because there's only so many of us to get around. If you can't, that's fine. We'll make it out to the house. PayCor, that will be going live on April the 26th, and that's going to be for the payroll of 4/7 through 4/20. You'll get 2 weeks on the 26th. HHC is our documentation system. That's where you're going to be entering in your visit notes, and schedules are imperative. So anyway, thank you so much for everything that you do to make this company fantastic. You'll be hearing more and more from me, more and more from people that work in the office that are dedicated to helping you be successful. And that's all. I'll talk to you soon. That's your first episode of Emerald Excellence.